On this day, we find Melissa Wright delivering mail. You may remember last time we talked to her, she was delivering supplies for her backyard project.
We have a shed arriving tomorrow.
Her complaint then was a homeless camp near Lent Elementary School, just down the street. We saw it there that day, just feet from a playground fence. And nearby, another sprawling homeless camp that neighbors had long complained about. But here we are 2 months later, and according to Melissa, things are looking better.
The camps got cleared that I spoke to you guys about, that are over by the school. So everything's posted, no camping, and 96 has been cleared. Everything's been cleared. It's been really nice to both deliver and live in the neighborhood.
And sure enough, when we checked out that spot behind the school, the homeless camp was gone. And just down the street, that large encampment has been moved. But Randy Lucas and Cindy Highslope aren't ready to celebrate just yet. When we last spoke with them, they complained about those camps nearby and crime in the neighborhood. They even locked down their lawn furniture after someone had walked away with their Christmas decorations last year. They do see some progress, but not enough.
I think it's whack-a-mole. I think, they do one small thing and then it just moves somewhere else, and then they whack that problem, and then it moves somewhere else.
I think that they're trying, but I think that they're a little bit dysfunctional right now, a lot dysfunctional right now. I don't think all of the departments are working well together to solve a problem. They're all just pointing fingers and trying to put a Band-Aid on each little thing, the things that they can do.
Both Lucas and Highslope feel too many laws don't get enforced in Portland, that the criminals know it, and that's the crux of the problem. They're hoping to see more progress in their neighborhood. In the meantime, are keeping their eyes open and their fingers crossed.
We're just hoping our Christmas decorations will make it this year.
Have you put them up yet?
No, they're going today.
They're going today. But this time with new security measures. A neighborhood in crisis with hopes for better days ahead.
Everybody's under a great deal of strain, and nurses are being told they just have to do more with less again. And
U.S. is experiencing high hospitalization rates due to a so-called triple-demic. According to the Department of Health and Human Services, more than 80% of U.S. hospital beds are taken. In Oregon, the situation is even worse, with officials telling us 95% of hospital beds, sometimes more, are now taken. Oregon Governor Kate Brown yesterday extended an emergency order that previously only covered children's hospitals and now applies to all hospitals. Thanks for joining us for K2 News at 6, everybody. I'm Steve Dunn.
And I'm Rick Gaz, waiting for Deborah Knapp. K2's Christina Giardinelli is live now in Portland after talking to health officials, hospitals, and nurses. Christina, are healthcare workers going to get more help in this new crisis?
Yes, because hospitals like these are primarily dealing with a staffing issue. The state is bringing in extra resources from out of state, but in talking to the workers here in Oregon, they're saying they want more help dealing with yet another crisis, and they say they're not getting that help. I did ask health officials today if they plan on spending any of that money going to out-of-state workers to help those nurses and aides here in Oregon. It proved to be a question that was hard to get answers to. We saw signs like this one, praising the hard work of healthcare workers and nurses outside nearly every hospital during the pandemic. Officials say now those same heroes are dealing with more overflow of patients. Dean Seidliger is the state's health officer and epidemiologist.
The combination of surging flu, RSV, and COVID-19 cases is pushing hospitals past their current ICU bed capacity, which never happened during the darkest days of our COVID-19 pandemic in Oregon.
Oregon Governor Kate Brown has allowed the spending of up to $25 million to bring in out-of-state hospital workers. Nurses tell me this will help, but they want more resources to help them deal with the workload they already have. Matt Calcia is a nurse and member of the Oregon Nurses Association.
we need to keep them at the bedside, so we should see some investment in incentives for working extra, incentives for working in crisis standards of care.
Calcia says nurses want the National Guard to be sent in to help with answering phones, transporting patients, and other administrative tasks that fall on them. During a press conference, multiple reporters asked Seidlinger why that isn't happening.
There's a lot involved in bringing up the National Guard. Those National Guard members most of them have full-time jobs, and so often we're pulling them away from those other jobs which are critically needed during this time. There's also the need to do training and orientation and things so they can help out in these situations.
I'm going to go back to my previous question and my colleague's question because I don't feel like either were fully answered. We talked a lot about supporting hospital staff. Again, there has been no talk about supporting nurses. This is just as much, from what I understand, a staffing issue as it is a healthcare crisis. What is being done to make sure we're not losing more nurses, we're not losing more staff? Why are we not sending in the National Guard if we did so during COVID? And you're saying this is a worse situation than COVID.
Thank you for that question. Like I said, right now, what we need is, more licensed and trained individuals.
In the meantime, nurses say they could use that help more now than during the pandemic. Seidlinger didn't say why this situation calls for specialized staffing more so now than during the pandemic.
Portland police say that around 12:20 a.m. on November 19th, they were searching for a car they believed was involved with an armed robbery near Southeast Powell and Southeast 50th. An officer spotted a vehicle similar in description to the suspect vehicle that was driving recklessly. That car stopped in a parking lot. Officers say they tried to make contact with an occupant inside. Then investigators say at 12:41 a.m. an officers shot Emmanuel Jaquez Clark Johnson. He was taken to a hospital, but on November 23rd, police say that Clark Johnson died from his injuries. Police have not detailed what happened between the attempt to make contact and the shooting. Now, Emmanuel's mother joined the group protesting outside the Multnomah County Justice Center tonight. She described her son as bright, funny, and full of life, but said that police are not giving her any information.
I don't even know what's going on. They haven't given me anything. They haven't given me any information. So I think that's wrong. And I want to change the laws and try to, what they do, how they do it. It's in my son's name, Emmanuel Jaquez. And we're going to change the world.
Now, Portland police said they are investigating the incident in conjunction with the Multnomah County District Attorney's Office and East County Major Crimes Team. They also indicated the case will go before the Police Review Board. We reached out both to the Portland Police Bureau and the District Attorney's Office tonight in response to the demonstration, but we haven't heard back yet.